Hello everyone, Dr. Brent Sanderson here, a fifth-year orthopedic surgery resident in Ventura, California, working at Community Memorial Health System. I'm excited today to bring you along and show you what it's like to be an orthopedic surgery resident here in Ventura. It's going to be a busy day. We start around 5 o'clock, 5:15, head into the gym first, and then we'll head to the hospital around 6:30 for morning rounds. So why don't you come along for the day and we'll show you a little bit what it's like to be a resident. Good morning, we're at Community Memorial Hospital this morning. We're gonna do a little bit of morning rounds. We start at 6:45 every day, so let's head on in. I think CMHS residency program here is so special because of the people. I think the people make the place, and we're just lucky to be able to train in Ventura, California, where it's usually 75 and sunny, and there's a surf swell coming in the next weekend. But I think what makes it special is my mentors here, my attendings that are here. They're amazing surgeons, but also amazing people and humans behind the mask, as well as my co-residents. I think they're so special. In between each of the cases, we are able to talk about the cases and learn from each other, learn from our mistakes, learn from our exciting times, the bad times, the good times. I think the people are what make this place special. But we're going to throw on lead, so you're welcome to stand back a little bit as we do this. I found that CMH provided a very wide variety of cases, but not too many and not overbearing. Being an intern was like drinking from a fire hose. That's a very common phrase, and it was like that here too. But it was a great place to have a very good work-life balance where you could train with amazing attendings and co-residents that really wanted you to succeed. So we're here today in the same-day surgery lab. We have a cadaver that's brought in by our friends at Stryker. And behind me, we can't show you guys, but we are currently working on an ankle where we're going to be doing an ankle X-fix or external fixator. And the fifth years are going to be walking through the first and second years through the X-fix. I think the best way to explain orthopedics or orthopedic surgery is to break down the word. And so ortho and pedic is just to make the bone straight in Latin. And so that was the original meaning of orthopedics, is to straighten the bone that is broken. But really what we do is anything that is in the musculoskeletal system that has gone wrong, from injury to trauma to oncology, is usually we have a hand in and we help fix that. Here at Community Memorial Health System, we are lucky and privileged enough to work at multiple hospitals. Currently, we're at Community Memorial Hospital in the old Mountain Tower, but we also work up at Ojai Valley Community Hospital, participating and assisting in cases with Dr. Golden, Dr. Sweet, Dr. Forsychus. Dr. Golden, who is our program director, he serves as basically the leader of the entire residency program at CMH, and he's in charge of all 20 residents, and we joke with him that we're the sons and daughters that he never really wanted, but he secretly did want. We're heading to clinic today. We're going to Dr. Golden's private office where we'll see about 20 to 25 patients this morning, so let's come along. Here we go.
So my name is Thomas Golden, and I'm the program director of the Orthopedic Surgery Residency at Community Memorial Health Systems. Yeah, so Dr. Sanderson is a unique individual. He's extremely intelligent, and he's a super nice guy, and he understands the importance of taking good care of patients. So He's aware of the latest techniques in orthopedic surgery. He reads a lot. He's up on the current literature. And when he's with me in surgery and doing cases, he does so in an expert fashion that is certainly a joy to witness and see. What kind of didactics do you have Monday?
What kind of didactics that I'm going to be with in here?
Well, let's
in
see.
the case.
So for me, it's just a joy at this point in my career to be able to teach the residents as they go along through their training how to take care of patients and actually accomplish the surgeries in an expert fashion to the point where when they graduate, they're ready to go out on their own and do orthopedic surgery well.
So starting out as a medical student, as a third year and fourth year, you do audition rotations, and so you're able to rotate at a bunch of different hospitals, usually 4 to 5 4-week rotations, and you serve as the helpers or the assistants of the interns and the second years of the orthopedic surgery team, and you're a vital part of the team at that point, especially here at CMH. And then as an intern in a second year, your really priority is to help out on the floor and to really become a great first assistant in the operating room. You need to learn to first assist before you're allowed to do the surgical procedure. And so that's during intern year and second year. And then third year and fourth year is when the autonomy starts to get more and more, when you get more and more capable of doing the surgical procedure under direct supervision of your attending physician. And then during fifth year, that is your time to develop close mentorships with your attending physicians.
Interview exactly. The celebrity.
You're the celebrities.
Dr. Sanderson's the best.
Get that on film. The benefit of having residents involved in your orthopedic surgery cases, especially at CMH, is that you have a dedicated individual who has put forth almost 5 to 6 years in training to get to this point to help out with your procedure or your operative case. That means that if I'm part of your surgical team, the night before I am researching all the new techniques that are on PubMed or the evidence-based medicine, the new literature on the outcomes for the procedure, what we could do differently, so many different avenues and so many different variety of ways to treat your problem or to help with the case, that everyone is very active and ready to go to help with that operative procedure.
The information that's available for residents to learn with technology is just incredible in terms of just computers and videos and improvements in techniques. I think that we put a lot more emphasis now on the well-being of the resident, which when I was a resident, nobody seemed to care too much about my well-being. I just worked really hard and got through it. But we try to pay attention to how the residents are doing in the program, and we try and get together socially, and we care about their families and that sort of thing.
Currently, we're in Dr. Golden and Dr. Horvath, our program director's office, which really we converted into our chief office, or just an office that we can study, do research, and get projects done throughout the day. I think the first lesson I learned as an intern was how to be humble and how to know when it's time to ask for help when you're outside of your comfort zone. I think we get put in a lot of situations where we've never seen something before, or the expectation is that we need to look it up and be prepared, but we really have never done a procedure or never seen that type of patient before. And I think humbling yourself and having a perspective on, okay, this is a time I might just need to ask one clarification question before I go into a patient room, or I'm assisting on a surgery, I need to ask a question before I proceed. All right, so welcome to the operating room. There's no patient here today. All the patients have gone home, but this is a normal operating room setup. We have the anesthesia machine here where our anesthesiologist does a great job intubating the patient and keeping the patient stable while we do the surgery. I think being a resident has taught me that I need to be a lifelong learner and be able to adapt to all the new changes and all the new evolution that medicine and
orthopedic surgery is undergoing at this time. I think it's amazing to see from my first year to my 5th year all the different changes and advancements we've had, whether it be in the surgical arena or in the office. The way we treat patients is totally different within 5 years, and I'm really excited to keep learning and developing my skills as I become an attending physician.
All right, we'll see you after the case, all right?